Good morning, Cleveland County. I'm Dr. Gregory Greer. I'm the Administrator of Child Welfare and Adult Services at Cleveland County Department of Social Services. I'm here today with our Health Director, Tiffany Hanson, and our Assistant County Manager, Carrie Melton. Tiffany and Carrie will be providing an update on the status of our community, our metrics, and some timelines in regards to when people can get vaccinated. Tiffany?
Okay, thanks, Greg, and thank you for joining us today. As Greg mentioned, I'm just going to go over our COVID-19 vaccine update, any changes that we've seen over the last couple weeks. I'll start with our just data. Locally, we have 10,358 total cases of COVID-19 in the county. We have around 168 active cases, so 1.6%. We unfortunately have 217 deaths in the county, so 2.1%. And we have 9,973 recovered cases, so 96.3% of our cases are recovered. I'll draw your attention to the bottom of the slide. Our percent positive for Cleveland County is around 6.5%, which we've seen a decrease after the holidays, a substantial decrease. We were around 17%. The first of the year, and so that's a great improvement compared to the state of North Carolina, where they are at 4.2%. So I think we still have some work to do here, and we just want to continue to be mindful of the 3 W's and wearing our mask and washing our hands and being sure to remain 6 feet apart. If you're following the Ncdhhs COVID dashboard, this is a picture off of the vaccine portion of that dashboard. And so as you can see for Cleveland County, we have 14,115 first doses administered, so just over 14%. And we have 7,894 second doses that have been administered, so about 8% of our population. I think this is just a wonderful kind of diagram here or image to show really where we are across our demographics, across the state, how we compare to others. I think we're really doing a fantastic job. This is the Ncdhhs Framework, which you have seen several times. The governor made an announcement last week on Wednesday that we were going to be moving into Group 3, so our frontline essential workers. We continue to vaccinate both Groups 1 and Group 2 as well, but now have opened up to Group 3. Group 4 is on timeline to begin vaccinating on March 24th. We get a number of questions about who falls into Group 3. So we know as of last week, Group 3, we started with our pre-K through 12 educators and teachers, and then also childcare, but now we've rolled into the rest of frontline essential workers, Group 3. They fall into 8 sectors. So here on this slide really shows what those 8 sectors are: critical manufacturing, education, essential goods, food and agriculture, government and community services, healthcare and public health, public safety, and transportation. COVID-19 inventory for the week. So this is our latest update. As of this week, we've received 10,970 doses of COVID vaccine. We've administered 9,692 vaccinations, so about 88%. We have 227 appointments scheduled for the remainder of this week, and we've partnered with Shelby Drug and Mountain Street Pharmacy to administer an additional 300 doses this week, bringing us to a grand total of 93% of our doses being administered by end of day Saturday. Exciting news for next week. So our next week's allocation will be 1,170 doses of Pfizer vaccine. And then we also will be receiving 300 doses of Moderna vaccine.
That's great.
And a couple things with this really are that the allocation diagram you see here that we post weekly is just first doses. So this portrays all of our first doses because we get matching second doses to administer. So if you did receive a Moderna vaccine, we will still be getting your second dose Moderna vaccine. If you receive a Pfizer vaccine, we will get your second dose Pfizer vaccine. And just keeping in mind which vaccine you're getting as we move forward, because it's very important that when you return for your second dose clinic, you have the matching vaccine administered as well. If you are fully vaccinated, there are a couple things to keep in mind. So Ncdhhs continues to stress really how important it is to continue our 3 W's. So wearing our mask, waiting 6 feet apart, and washing your hands. And this in large part is because we need to reach that herd immunity number. And so really just continuing to encourage people as we vaccinate to do the 3 Ws. If you are vaccinated and exposed to someone with COVID-19, there's a couple things here that are beneficial, and Ncdhhs has rolled into implementation. If you're fully vaccinated and within 2 weeks of your second dose and at least 3 months from receiving that second dose and have no symptoms, you do not need to quarantine. So there are some definite benefits of receiving both doses of the COVID vaccine. Upcoming events to keep in mind, Atrium is going to be doing a mass vaccination event at Shelby High School this weekend from 9 to 4. You can schedule appointments at atriumhealth.org or call the number. I know they had a few appointments still available for both Saturday and Sunday, so I would encourage folks, if you haven't been vaccinated through one of our clinics this week and are still hoping to be vaccinated, this is another event happening locally. And how do you schedule a COVID-19 vaccine? This week, just for us trying to be flexible with our planning and understanding of those that fall into essential frontline workers or a lot of our workforce, we have launched a vaccine registration form online, which you can find the link here. Those are available based on vaccine dose allocations, and so that registration form will also close when we've met all of our appointments for the following week. We will also have our phone lines open today starting at 1 p.m. So that's at 980-484-6019 number. And once all of our appointments are filled for next week, then that line also will play that message about all appointments have been filled. That's all I have for updates. Carrie, do you have anything that you'd like to share, or Greg?
One thing real quick, when we talk about vaccine appointments, I know a lot of folks these days are signing up at different locations for an appointment. So I would encourage people, if you sign up through our online portal or the Atrium portal or the Walgreens portal, if you're on all of those lists or don't have an appointment, if you could call the health department and let us know if you've received a vaccine from somewhere else, so we're not having to call people back and then they say, I've already had an appointment. So I just encourage citizens, if you get an appointment from another location, I'm excited. We have so many community partners right now, so many opportunities for our citizens to get vaccinated, that if you do receive a vaccine from somewhere else, if you can call the health department and let us know to take you off that list, would really appreciate that. But Greg, I heard you had your vaccine this week, so why don't you tell us about that experience you had?
I did, and it was, what I will say is, I appreciate our health department. I appreciate the nursing staff. I am not an advocate of getting shots or giving blood, to be honest with you y'all, but they made the process very seamless. I received the shot in my left arm. I will say that it was very sore afterwards, and the next day I was tired. That I received it on a Saturday. I was tired on that Sunday. I just didn't feel like doing anything. A little bit that way on Monday morning on my way into work, but by Tuesday I was back to normal. It was still, in regards to the soreness, what I will say is, if you receive the shot in your left arm or right arm, whichever arm it is, do not sleep on that side that night. And I did call my grandmother, and she advised me to, rub some alcohol on it. But other than that, my side effects are very minimal, and so I'm hoping for the same thing in regards to my second shot. I would also like to say, my wife works for Cleveland County Schools, and so she took her and one of our closest friends on this past Saturday for the Cleveland County Schools drive-through event, and my wife and one of our friends, they both did well as well. They had some soreness, so didn't really want to move their arm too high. But other than that, they both were able to make it back to work on Monday morning. So it's really been good, and we feel good that we've received our first vaccine, and we're going to receive our second one in mid-March, and so that we can be fully vaccinated.
Tiffany, I know we've talked about in the past, really in the beginning, of Pfizer, Moderna, Johnson & Johnson. Can you talk a little bit about, I know for a long time Cleveland County government was only receiving Moderna vaccine. Now we're receiving Pfizer on a regular basis. Can you talk to us real quick about just kind of the differences between those two,
Yeah.
what people can expect.
So as Carrie mentioned, previous to this week, we have received almost entirely Moderna vaccine. And so really Moderna and Pfizer efficacy about the same, 94% for Moderna, 95% for Pfizer. Side effects for both, according to phase 3 trials, are almost identical. The soreness, the redness, the tenderness that Greg spoke of, the headache, the fatigue, nausea, those are very common in both of those and about exactly identical. The really big thing for these is the ages that can be vaccinated. So for Pfizer, it's 16 and above, and for Moderna, it's 18 and above. The other key difference is the number of days between the first and the second dose. So for Pfizer, it's 21 days, and for Moderna, it's 28 days. And so just really keeping in mind when you're completing the registration form to make sure that you're 16 and above for Pfizer eligible and 18 and above for Moderna and eligible, as well as when you receive your appointment time for your second dose to make sure that you are receiving the second dose to match the first dose.
And for anybody who might forget which one they have, our Pfizer vaccines will have a pink sticker on them, and our Moderna vaccines will just have a white sticker on them.
And Tiffany, can you talk a little bit about, well, people have the opportunity to select which one they take?
Yeah, so the last 2 weeks of our kind of vaccine allocation, our last 2 weeks, this week and next week, our Moderna clinics are traditionally held on Mondays and our Pfizer clinics are held on Wednesdays. If our team is reaching out and calling, or you call in via our phone line, they will give you the opportunity to schedule for either a Monday or a Wednesday clinic. And so if you want one or another, you can let them know that I would prefer Moderna or Pfizer. They are virtually identical, like I mentioned, as far as side effects, and they are 2-dose series. But you are able to mention to either one of the operators or when you call in on the phone lines, which one would be your preference.
Do we have any questions come in?
I do have one. So will the county have enough of the respective vaccines, i.e. Moderna, Pfizer, to ensure we get the second dose at the scheduled time? Please confirm or explain how the county ensures there is no mix-up in doses, i.e. Moderna first dose and Pfizer second dose.
Yeah, so this is a question we get a lot of times is, do you get the second dose to match my first dose? And we do. So the shipments actually come separate, and they have a separate lot number for all of our second doses, and that inventory is stored separate from our primary doses to ensure that we have every second dose to match every first dose. And Jamie, what was the second part of that question? I'm sorry.
It was just, how does the county ensure there's no mix-up in the doses from the first to the second?
And as Carrie mentioned, so for our Pfizer vaccines, your immunization card actually has a fluorescent pink label on it. First, to give our team a visual that you received Pfizer for your first dose, to really ensure that when you're coming in for your second dose, that you get the same second dose that you received the first time. And then also the nursing team then verifies the consent and verifies in the online registration system to really ensure that you receive the proper second dose.
Can we expect the Johnson & Johnson vaccine to be distributed in Cleveland County?
So that question is, we don't know yet. What we do know is that North Carolina DHHS has said that the 80,000 Johnson & Johnson that the state received this week and likely next week are really being earmarked for those very rural, hard to reach counties, hard to reach populations where that first dose is super important to get to people that maybe can't get to other sources to get the vaccine. Currently for our allocation, we do not have any Johnson & Johnson in Cleveland County, but I only get allocations for 1 week in advance, and so that could change. As of this week though, we are not receiving any Johnson & Johnson.
Then when weekly dosage allocation quantities are announced, do these numbers include second doses, or does that number only consist of first doses?
So when we do our vaccine update on Fridays, that table includes only first doses because we get the matching second dose, and so those allocations essentially are already spoken for, and so we only report the first doses because we know that those are available appointments and available vaccine.
One thing I want to add there too, when Tiffany did her update, you saw 2 different numbers with respect to vaccinations. The first chart showed about 14,000 first doses administered, and the second chart showed about 10,000. The difference between that really was that the 14,000 included all the other providers, other places that folks have gone to get vaccines, whereas the 10,000 only included the vaccines that Cleveland County Health Department actually administered. So we don't have the ability to track as well on a real-time basis other vaccine providers. So that's the difference in those numbers.
And when you talking about the metrics, we like to commend our community because we have a population of about 100,000 people here in Cleveland County, and about 20% of our population has received the vaccination, and that is great. That shows that we care about getting back to normalcy. It shows that we care about taking off our mask when the time comes, and are truly trying to impact and curb the pandemic.
The last one I have so far is, do you have to make an appointment for your second dose?
So for second doses, you do not have to make an appointment. When you get your first dose, you will actually receive your appointment time, and usually those are broken out by hour increments. And so we really encourage folks to come at the time that they've been assigned in order to reduce kind of traffic flow and to make sure the process goes as seamless as Greg described. And so you don't have to make an appointment. If you are unable to make your assigned date or time, we encourage you to call through our COVID helpline, the 5316 number, and talk through potential opportunities to come on a makeup day.
And Tiffany, that brings up a great point. I would also like to say that, I've heard that, some of our elderly population have been concerned about, the drive-through, filling out the forms. The nursing staff, the volunteer staff are more than happy to help fill out the forms for anyone that wants a vaccination, and so they will help fill it out for you or do it for you and ask those questions. So anything that we can do to help our community through this process, Tiffany and her staff, our county administration, Carrie and Brian, have been awesome and ensuring that we have volunteers there to make the process as easy as possible for the citizens of Cleveland County.
The other thing I just want to add about appointment scheduling and helping folks, I hope our community sees that as we move to each step or each group, we're really taking the approach of what is the best method for reaching folks. So as Tiffany mentioned, this week with our frontline essential workers, we really understood that it would be extremely difficult for folks to be on the phone for several hours at a time to try to get through, which is why we opened up our online form. Our intention originally, we did not want to do that. There are counties across the state that have waiting lists of 20,000 people. So we did not want to do that originally, and felt like we were successful with the phone lines, but we do understand as we move forward, the difficulties in getting through on the phone line are an issue, and we wanted to find another method to help folks. So I hope you all saw that website or the online form. You can go to clevelandcounty.com. There'll be a box on the bottom about COVID-19 updates. You can click on that to get to the form, but that is available for anybody, and we'll keep that list. It will close, like Tiffany said earlier, when we get past the number of vaccines that we have, but we hope that will be an added customer service enhancement for our citizens.
Any other questions?
Any other questions from you guys?
I don't think so.
Okay.
Anything you want to add?
I don't think so. I think really just encouraging folks, if you have any questions that maybe we haven't answered, to call through our 5316 phone number. The helpline is very well-versed and educated on every process and question that we have. Carrie and I and Greg also would be more than willing to answer any questions that you may have, or otherwise we'll likely see you in 2 weeks for another update.
Awesome. Thanks, everyone. Have a great weekend. Happy Friday.